Hearing a lot from our viewers about whether all these measures are really necessary.
Dr. Mallika Marshall has one of Boston's top infectious disease specialists here to help us understand why these steps are so important. Mallika?
Thank you, Paula and Liam. So joining me today is Dr. Paul Sachs. He's a professor at Harvard Medical School and a doctor at Brigham and Women's Hospital, and he specializes in infectious diseases. Thank you so much for coming.
You're welcome. It's good to see you again.
I know.
I remember you, Dr. Marshall, from your residency.
That's right, residency at the Brigham. I trained under you. He's a very, very smart doctor. So we talked a little bit about social distancing, and I know that there are still people out there who sort of poo-poo this whole thing. It's much ado about nothing. Why is social distancing such a good idea?
That's important for two reasons, both for your personal health, because it means you're less likely to get exposed to the virus, but also for the benefit of others, because when we spread the epidemic out, when we so-called flatten the curve, we reduce the stress on the system, and the system really can't take too many extra sick people at any one time. So it's very important that we do it both for ourselves and for society.
And you're recommending it for everyone, not just people at high risk.
We are recommending it for everyone, but in particular for those at high risk. You know, it does sound like such a loss of freedom to tell people, you know, you really shouldn't go to concerts, you really shouldn't go to closed spaces, you shouldn't go to restaurants and bars, but that is the advice we're giving people right now.
Okay, so earlier in the crisis, we were reminding people that the flu has been killing so many more people here in this country than coronavirus did at that time, and certainly does now. But maybe we went overboard, because now everybody's like, it's just like the flu. Why is this different from the flu?
So, you know, I like to start by saying it's not a competition. These viruses are not competing with each other. They're both potentially very serious. The flu, of course, we know there's this seasonal peak and then it goes away. This is a totally new virus coming into a population that is susceptible to it, and it's our population, and we are very much at risk of having the kind of exponential growth that they saw in China when it first appeared. So that's what's happening now in the United States, and we really have to be prepared. We know from the experience in northern Italy that it's much better to be prepared ahead of time than to have to react to things as they're happening later.
There's been a lot of confusion about sort of contagion, like when are you contagious? Is it possible to be contagious before you develop symptoms, and then how long after you develop symptoms?
Right. So we are, based on epidemiologic studies, people are at their most contagious when they're at their sickest. And when people look at how did it spread, it often spread within families or within tight, closed workspaces. But there is some evidence that it might be contagious just a little bit before they start getting symptoms. But that people shouldn't focus on that. It's really the symptomatic cases that spread it to others, which is why it is absolutely critical that people not go to work if they're sick. Or if people are sick, that they stick to themselves in their homes. It really is very important, because that can prevent community spread.
And people, when they're feeling better, they're probably less contagious, but studies have shown that they still can shed virus, but less likely to pass it on to someone.
That's right. I mean, the studies of some of the sickest patients show they can continue to shed the virus for 7 to 14 days. But you know, in general, when people recover from viral infections, they start becoming less contagious, and there's less virus to be spread.
As an infectious disease expert, specialist, are you optimistic? I know we feel like we've lost some ground, right?
Yeah.
But do you think that we can play catch up and make a difference? And
I think we can, and I have you know, some optimism about it, because I've seen some places that have responded really quite brilliantly. I think South Korea has done a wonderful job in accelerating testing, accelerating containment, and bringing the curve down in the epidemic. The same thing has happened in China after, of course, a tremendous outbreak there. But it's going to take a lot of community effort, medical community, non-medical community, public health officials, and really we should pay attention to their advice.
Cautiously optimistic.
Cautiously optimistic.
That's good.
Okay.
Thank you.
Welcome.
Thank you so much for joining us, Dr. Sachs.
Thanks
Really appreciate it.